Okay, so everyone watching me, thank you very much for making time to watch me. My name is Ernest and I am with Consummate Health Foundation. Today, we want to spend some few minutes to talk about one condition that has actually been detected in Guinea, and so the Ghana Health Service is also prompting each and everyone to be on the watch about this condition, that is the Marburg virus disease. So if you are watching me, I want you to exercise restraint and then learn something from what we are going to talk about. So when we talk about Marburg virus disease, it is a hemorrhagic fever, something of that sort, or a hemorrhagic disease, and it is likened to Ebola virus disease. Okay, so the Marburg virus disease is something similar to the Ebola virus disease, but it is not the same condition, just that they have similar signs and symptoms, but not the same condition. For the causes, that is of the two conditions, the Marburg virus disease and the Ebola virus disease, they are similar, but they are not the same again. So for Marburg virus disease, it is caused actually by the consumption of the fruit bat, or commonly we say bat. So if it is infected and then you also consume, you can get this disease. But apart from the transmission from the bat to humans, there is also human to human transmission. So if I have it, I can also transfer or transmit it to you as another human. So we say human to human transmission. Now, the condition has been detected in Guinea as we speak, and then there's one mortality or death recorded in Guinea. And so it means that everyone within the Sahel region, everyone within Africa must be on the watch, and every other person, where some of these diseases are highly contagious and can spread very fast. Now, how would I know? We have talked about the cause and then what the disease actually stands for to say. Now we go on to the signs and symptoms. The disease actually begins or starts as with feverish feeling, and so the person or the patient may complain of headache, fever, general body pains, nausea, vomiting, diarrhea, and so on. And as it progresses, so these are some of the feverish conditions that the patient may complain about. But as the disease progresses, then there will be other extensive complications, or if you like, signs and symptoms that may also be seen, like the patient bleeding from the orifices. And so you may see a patient bleeding from the nostrils, from any other orifice, from the ears, from the mouth, from the anal region, from even the sexual organs, the nostrils also. So that is when the disease progresses. But like I said, it is highly contagious and deadly. Because of this, it has a very high fatality rate, if you like. And so what we actually want you to learn or know today is that if any relative, a patient, if you're a health worker, or any other person present or starts to show some of these signs and symptoms, it is advised that you send the person to any nearest health facility or call on experts to visit and to send the patient to the health facility. Now, how can I contrast this apart from the bat? How does the human to human transmission occur? So once I have it, I may be vomiting, I may have diarrhea, I may have all other means by which fluids can be shed. Once it gets into contact with you, it means that you can also contract it, and then the transmission continues. And so it is always advised that when someone is suspected to have the disease, the person must first and foremost be sent to the hospital. Don't keep people at home and say it is malaria. No, for us, every disease has been malaria. No, send the person as much as you can, as fast as you can to the hospital. And also, if you are a healthcare professional, you must always ensure barrier nursing, or always protect yourself. Use the appropriate PPEs when caring for patients. Now, because this disease actually resembles, to say, other disease conditions that we are all actually familiar with, it is always expected of you as the healthcare professional, even a family member, whoever, that when someone starts to present some of these signs and symptoms, you have to find out about travel history, because now it has not been reported in Ghana as I am educating you from, but it has been reported in other parts or in Guinea. So it is within Africa. So if the person has traveled recently, then it means that the person might have contracted the disease from there, so that we don't take it for granted. So now we have talked about the disease, we have talked about some signs and symptoms, we have also talked about the transmission, how it is transmitted, and we have also talked about how to protect ourselves from contracting it. Now we want to finally talk about some of the prevention and control measures. So like I started by mentioning, for prevention and control, you always have to ensure what? Barrier nursing. If you are a nurse, you are a healthcare professional, use the right PPEs in caring for patients at all times, not when the condition is suspected. No. Also, we have to cultivate that habit of washing our hands frequently. So we don't have to be lazy with this. We have to learn to wash our hands frequently, just as we have been doing now because of coronavirus. We have to wash our hands under running water with soap frequently, so that even if you are coming into contact with someone, as you wash, your hands will be clean so that you don't touch other things, and then even it will infect your own self. Now, another thing that we have to take note of is that if someone is suspected to have the disease, by way of preventing transmission and by way of controlling, we have to learn to report very early. And by so doing, we will be able to curtail the spread. We will be able to curtail the spread. So this is something small about the prevention and the control. To end, we have talked about Marburg virus disease today. I said it is something that a disease that is similar to Ebola virus disease, but it is not the same as Ebola. We have talked about some of the signs and symptoms. It also presents, because it's a hemorrhagic fever, it also presents just like Ebola, but it is not Ebola. We have talked about some of the signs and symptoms. It presents like malaria and some of these basic or familiar or similar conditions like malaria, enteric fever, and all of these conditions. But it doesn't mean that when patients start to present the signs and symptoms, we have to take for granted. We have also talked about the prevention and control. Thank you very much for watching.